Good afternoon, people. Good morning, people. Good evening, people, depending on where you're at in the world or when you stumble across this video. I'm Emoja, representing the BIO on this fine day. And today I wanted to do a do a random video about trauma in Black America, and I was working on writing a piece, and I was like, this would be a good a pretty cool video to do a little change up from what we normally do. And I decided to just randomly do a video about it. And I want to talk about how we heal from trauma while constantly dealing with drama. And and I'm gonna come full circle to touch on how nationhood, as usual, is the key and the answer to this. Before I start and diving in, I want to just kind of qualify myself to speak on the matter. Prior to my current profession for 10 years, I worked in the addictions and mental health field. My last job, I was actually a clinical social worker, and part of that job, I was responsible for assessing and diagnosing people with severe to mild mental health disorders, and I worked in an all black clinic too. So I do have professional and personal experience with this topic, just to be clear. And while I'm doing this, like this is not a legit diagnosis of people. I'm not, gonna suggest people go to a psychiatrist and get medication and all this other stuff. So no no lawsuits or no saying that I'm trying to give therapeutic advice or anything like that. It's not that kind of party. But let's start with a case study. Let's say you have let's pretend and role play that you're a therapist, and you have a man or woman comes into your office week after week, and their chief complaint or their main concern or their main problem is that they living in a home under extreme stress from domestic violence abuse. They're physically abused, they're economically abused, they're psychologically abused. The kids in the home are abused, and week after week they come through and they talk about this stuff, and they're telling you that their lives are unmanageable. They're having a hard time in their daily activities, but they really don't want to leave. They just want the relationship to work. And as a therapist, it'd be almost a malpractice to suggest that the person just goes back to the home and just hope that everything is okay. Do their best to keep from getting beat down. Do their best to keep peace in the home. You know, it will actually be more in the scope of practice to immediately try to call for help. Like like in some cases, it would even be appropriate to call authorities and say, "Hey, this woman is like close to dying." And there's also some child abuse going on. Like it's called being a mandatory reporter. So let's just start with that first case study, right? You have this person, they're suffering from severe domestic violence abuse, and they're coming through with all these trauma symptoms, but they do not want to get out of the situation. They just want it to get better. Now let's talk about PTSD, because this is what I'm quote unquote diagnosing Black America as a whole with suffering from. And as a clinician, you have or as a mental health therapist or qualified mental health therapist or practitioner, you have what's called the DSM-5. It's the fifth edition. The DSM-5 is the diagnostic and statistical manual of mental health disorders, and in America, it's what's used to diagnose mental health disorders. And how they use it is they have a bunch of criteria, and in the criteria, it has a number of symptoms. And if a person meets this criteria, then you could legally diagnose them with a mental health disorder and suggest they get treatment, medication, so on and so forth. Now we're going to focus on, well, we could focus on a lot of different issues, most of them being anxiety disorders and trauma disorders. But we're going to stick with PTSD because it's the most well known, and it's something that we all could identify with, particularly the symptoms. They're really easy to identify with. So the first criteria in PTSD, and sorry y'all if this is going to be a little bit more clinical, and it could be seen as boring, but it is so important when we talk about the mental issue and the stagnation that we continue to deal with in Black America. So the first criteria, criteria 8, is the symptom of having a stressor. And this is saying that the person has been exposed to death, threatened by death, threatened by serious injury or sexual violence. And it could be from either direct exposure, witnessing trauma, learning that a relative or somebody close, or indirect exposure to adverse details of trauma. So when you think about that in Black America, many of us have been in direct contact with violence by way of America, whether it's psychological, whether it's police brutality. And most of us, if not all of us, have been through this trauma vicariously by way of seeing Black bodies being killed by police or vigilantes. Even when you come to the struggles that we have in our own communities with gun violence and things of that nature. So that's one. The first criteria we all could identify with being exposed to this trauma. Criteria B is intrusion symptoms, and that's having the traumatic event being persistently remembered or re-experienced, and that could be re-experienced in nightmares, unwanted and upsetting memories, flashbacks, emotional distress after being exposed to it, or physical reactivity after exposure to it. And I could think of this one like, think about some of us may be driving and the police get behind you. Even if they don't flick on their lights, your heart might just skip a beat, or your gut, you might feel something in your gut. Even if I'm talking about license, insurance, you driving to work with your kids, you might still get a literal physical reaction just from the police being behind you, particularly if it's in a time where you just seen the police killing, or you didn't heard about somebody else got pulled over by the police or killed by the police. There's an automatic trauma response, even if it's anger, like, what the hell is these people behind me, man? I hope they don't pull me over. This is a trauma response. And I'm going to run through these as not to bore us with details and go through every symptom and give example. I'm just going to try to keep it really light so we can get through these symptoms. The next criteria, C, is avoidance. This one, we could sum this up about how a lot of us avoid the conversation of our treatment in America. Many of us don't even want to talk about it. You start talking about racism and racist issues, we could start rolling our eyes. We don't even want to talk about it. We want to make it seem like as long as we're working hard, got a job, getting some insurance, taking care of our families, everything is fine and everything is going to be fine. We don't even want to think about the horrors that we've been through in this country and what we continue to go through. So I could just cut that one short right there. We don't even want to talk about the conversation that we're having right now. We don't really even want to address. Many of us don't. Criteria D is having negative alterations in cognitions or mood. Now that might sound kind of complicated. How can we break it down? Like basically having negative thoughts or feeling that begin to worsen after the trauma. So that's like saying having overly negative thoughts and assumptions about yourself or the world. We could just keep it right there. How many of us have extreme negative thoughts about Blackness, extreme negative thoughts about America, extreme negative thoughts about certain subcultures in Black America, and we really dislike it to the point that we feel frustrated? Hell, the other day I was we was having a conversation, and I was like, man, these people make me ashamed. They make me ashamed of my Blackness, talking about a specific group. And somebody was like, man, no, man, nobody making me feel ashamed of nothing. And I was like, maybe I could have used a different word except ashamed, but sometimes I literally do. Not that I don't want to be Black, but it's just shameful to be a part of a group that is seen so weak, continue to get beat down and continue to not want to do anything but ask for other people to change instead of changing our situation ourselves. Moving on. Criteria E is having alterations in arousal and activity, like trauma related arousal from like, think of it like, no. Tomorrow is a different one. This just emoji doing a random stream. Tomorrow mornings is still going on. Rule of two. This was just a thought that I had. I meant to do it earlier in the week, but so busy and everything. I had a moment right now while my baby's asleep. I was like, I'm gonna just go ahead and get on now. I meant to pre-record it and just add it on. Like it wasn't even supposed to be a live stream, but yeah, tomorrow's live in the morning is still going on. That's routine. This is just a random one where I'm just coming up here talking mess my damn self. But back to the criteria E, is having irritability or aggression, participating in risky behavior, hypervigilance, heightened startle attack, difficulty concentrating, difficulty sleeping. And this could come from a myriad of things. Like this is I think that this is more seen in places where we're living in like real ghettos, real hoods, where you're hearing gun violence, where you gotta be on point because it's a bunch of tough guys or 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 you could think about like in work situations where you go to work with that I wish a motherfucker would kind of attitude. Are you always like just feeling like you have to overperform and outdo everybody else because you're the only black person in the school or on the job or something like that? And and most of these symptoms you have to have one or two, and we could have went through all of them and broke down how Black America do suffer from them, but I hope y'all get the idea. So we just went through a criteria, and with what I just said, you could diagnose somebody with suffering from trauma. Now let's get to a kind of a bigger picture of it. When we talk about the trauma that we've been through in America since its inception, there's something that's called, it's been getting a lot of headway in like the medical field and the mental health field, excuse me, and it's called transgenerational trauma. And they did studies naturally on like some of the cells from the Civil War soldiers, the Dutch hunger winter, and the people who was pregnant around then, and the babies from then, Holocaust victims, and all of them show like spikes in cholesterol, spikes in stress, even if they had good lives. And they're finding that parents, you could pass this through generations. And that's from something that's called epigenetics, and that's the study of biological control mechanisms of DNA. Basically, it's the how and why your genes are expressed. It gets really complicated, and I really don't want to go into that because that's not the purpose. The idea is to explain to us that trauma literally is passed down from generation, just like anything else, just like how you could pass your kids on a disease, cancer, HIV, like our genes work, that you could pass that is hereditary, just like anything else is passed down. Now, with that in mind, imagine the trauma that our greatest ancestors went through in America through slavery. Just imagine the horror that we put up with in slavery. And this was not only was it passed down genetically, but it was passed down spiritually by them saying that don't look at that white girl, don't look that man in the eye, work hard, you better keep your head down, year after year after year for hundreds of years. So we have this natural and biological response to our oppression. And when it comes out, now when we respond to it, usually it comes out in a negative way towards ourselves. We quick to want to hurt another black person, right? We're very quick to want to hurt another black person. But when it comes to hurting somebody who actually hurts black people, it seems like we want to pray for them. It seems like we want to let justice play out. You understand? And Joy, the great sister I really love, Joy DeGruy or Joy DeGruy. Her last name is spelled DeGruy. She wrote a book, great book called Post Traumatic Slave Syndrome, where she goes into more details that are just gruesome. And I don't want to traumatize people by going through all the details, but she writes a great book that says kind of what I'm saying. But what it doesn't state is the severity that those symptoms, how they affect us today. And what I want to get at is that it is impossible to heal from trauma when we're constantly dealing with it every day, no matter what, and it's inescapable. Even if you living in it, even if you, we could talk about how when all the last big one, George Floyd, you had sports players, you had actors, entertainers, people who are quote unquote well off in this system. All of them was coming to bat. Why? Because they're not just tired of the action, but because they feel that trauma. Think about when you see one of the 1,000 slave movies, or when you maybe watch a video and it's like you see a lynching, or you see something, another police killing a black person, you feel that pain like in your soul. If you care, if you care, there's another thing about trauma called dissociation. And that's where you, let me give an example of it that's not too gruesome, because we could talk about like sexual violence and how you dissociate. Then let's think about a doctor. Doctors are trained. Let's think of a surgeon, right? And they work on kids and infants and stuff. Doctors are taught to dissociate from the person they're working on and just focus on the work. So while they're cutting open this baby, they're not thinking this is a baby and it's sad and they start crying, right? No, they dissociate and say, this is my job. Similar to that, Black folks dissociate from our experience in America and just try to live and be happy because we feel stuck. I hope that makes sense. We literally ignore all the problems unless it's smack dab in our face. Sometimes it smacks us in the face, and then everybody want to come together and march and Black Lives Matter and all this other stuff. But day to day, we dissociate from the real issue, and the real issue is being American. It is that simple. It is impossible to heal from trauma while you constantly day to day dealing with drama. That's the whole point of this video, and I'm not going to drag it on and be long-winded about it, but I really want to stress the point that is unless and until we decide to get out of this place, we're going to have another generations after generation of what that transgenerational trauma passed down and passed down. I have a son. I've told my son, you are different. You know, when he maybe go out and come home late, or go out and or we talk about stuff that happened. I'm like, son, you're different. I've had conversations with him when I explain, you know, he's into sports, and I'm like, yeah, you see how like your Asian friends or your white friends or some y'all, because it's a cool thing to have everybody saying the word nigga, calling each other nigga, nigga, nigga. And I was like, but what's gonna happen? Michael's gonna be 30 one day, and he's not gonna be talking like that. He's probably taken over his dad's business, or he didn't went to school now, and his whole image can be changed. He's just gonna be a regular white man in America. You're the one that's gonna be looked at as a nigga, and that's why that's not cool. This is trauma past. See, how can we be our best self? How can we be our best self and live our fullest potential in a place where we constantly are treated as second and third class citizens? This is how we are. This is how we come up here. No matter how big and bad we want to puff our chest, no matter how proud we want to say we are, in America, we know damn well that we are not at the top of the food chain. Ever. Ever. Unless you want to talk about sexual exploits. Yeah, everybody want to fuck us, men and women. Cool. Yeah, everybody want our swag. Cool. And something else that I wanted to say is that we give each other props for dealing with this trauma for so long. We say we're a strong people, we're a resilient people, and when I hear that, I think of roaches, cockroaches. You know how people say cockroaches can survive a nuclear holocaust, right? Cockroaches are very resilient, but they're still a fucking roach. They're still a roach, man. No matter what, cockroach ain't shit. So I say that to say, forget being resilient. I don't want to have to be strong. Just like black women will divide themselves into that box of like, why do I have to be a strong woman? Why do I always have to take everything here? And this is true. This is super true stuff, right? And we can see that when we talk about a subculture of us, as in black women. Like, why do we always got to be the strong? I'm a strong black woman. I got to take care of the family and everything else, and I got to quote unquote heal this grown ass man type stuff. Why do black people continue to have to be seen as strong and fighting and struggle? We don't have to. Exactly. Yeah, strong and resilient, but don't control shit. Exactly. What's the point? I don't want to. Yeah, it just doesn't make any sense anymore. And the whole thing is that no matter what, when we talk about a Black Wall Street, when we talk about Black economics, when we talk about Black entrepreneurship, we can see all these things. But when it comes to really cracking the ceiling, all of us say, "But you know, these white folks ain't gonna let us do nothing." Man, but we didn't try that before and they bombed it. That's trauma responses. That's just giving up, right? And the truth of the matter is that, but it's right, because you coming home to this domestic, to this person who's beating your ass every day, and you coming home to him and you saying, I love this person, but I love this place. I've invested so many years into this relationship. I don't want to give it up. That's what we dealing with. That's what we dealing with as a people though. So the next, so when I hear us say, but we're not a monolithic people, we're monolithically getting our asses kicked. But we're not a monolithic people. Well, in unison, we seen as niggas here. We're not a monolithic people, and that monolithic attitude is keeping us where we at. At least cockroaches stick together. You see one, you know it's a whole gang of them in your house, right? We are a strong people. We are a resilient people. Yes, we the first people. Yes, we the chosen people. We're all of that we always bragging about, but we have no power here. And it's gonna stay like that. These people will push the button before they open it up to us. So I think I'm gonna end there. I didn't want to be on here long. I was thinking about 20 minutes maybe to get my thoughts out. Um, so yeah, pass this one on. And the entire message is that it's impossible to heal while you live it. It's impossible to heal from trauma while you're dealing with trauma. It just is. A war vet is not going to be healed from PTSD, from war violence, if he's still on the front lines. It's impossible. You're not going to heal from being raped in jail if you're still in jail. You're not going to heal from being a victim of sexual violence if you're still working in the sex industry. It's not going to happen. And we're not going to heal from American trauma still being in America. And we just live with it because we're a strong, resilient people. But again, cockroaches are strong and resilient as well, but they're still a fucking roach. I love y'all people. I'll holla at y'all people tomorrow morning, maybe. Thank y'all for whoever tapped in later. I hope y'all appreciate the video. Just try to give a different twist on nationhood and how it's healthy how it's good for our mental health as well. And that's just real. All right, y'all. Peace with it.